Hi everybody, Dr. Smith here, and I'm going to share with you today a neat treatment called a nasal-specific technique. And this is a great treatment for sinusitis. Katie here has been generous enough to allow us to demonstrate on her, and in fact we used this treatment on Katie last year for her chronic sinusitis, which lasted about 4 years before she started treatment. And luckily she hasn't had any flare-ups or anything since her treatment. It's one of the main treatments in the protocol for sinusitis. And what this does is it opens up the turbinate passages inside the nasal cavity. So on the side of the nose there's little fleshy protuberances called turbinates. And what they do is they stir up the air and it causes it to get more turbid as we bring it into the nose. That helps us to smell the different things in the air that we need to smell. But unfortunately, things like dust particles, pollution, and pollen grains can get stuck in those turbinates, all of which cause inflammation and can cause that stuffiness and that inability to breathe that is kind of one of the hallmarks of chronic sinusitis. So what I'm going to do is insert a lubricated balloon up into there and give a quick burst of air, and it's quickly going to open up that turbinate and allow that area to drain. So we'll decrease the inflammation, she'll be able to get more air back into her nasal passages, breathe easier, and decrease any sinus discomfort that she has. So there's 2 turbinates on each side of the nose, which leaves us with 3 cavities. So I'm going to start with the most shallow cavity first and work my way deeper and deeper, and we do this 3 times on each side. Ready, Katie?
Ready.
Alright. We start pretty shallow. Okay, Katie, taking a deep breath and hold it. Alright, and relax. Okay, so what you saw there was the most inferior or superficial cavity. We're going to get a little bit deeper now into the middle cavity. Okay, Katie, does that feel like we got back a little bit deeper?
Uh-huh.
Okay, taking a deep breath and hold. Here you are. Alright, now we're going to go back into the deepest cavity. This one goes way back, almost by where the eyes are. You ready?
Mm-hmm.
Definitely way back there. Alright, deep breath and hold again. And relax. And that's the nasal-specific treatment for chronic sinusitis. Typically we do both sides and then do some other adjusting and our Gyrol treatment and craniosacral as well to help a chronic sinusitis patient.